Today, we're going to test a theory. You've already had surgery on one knee, and your vet has told you that 65 to 75% of dogs tear the other leg within a year. Now, I'm not going to lie. Almost 95% of my clients that come in with a TPLO surgery on the first leg tell me that their dog plays ball, and usually with a chuck it. So why is it that this is better than that? Well, that's what we're going to discuss today. So if we look at this dog running forward, the ball never bounces the way you think it's going to bounce. And look at how he twists his body. And if you notice, this dog likes to turn to the right. And dogs are handed. If you look at Sam here, I tried him with a Frisbee at least 10 times. And he always wants to turn to the left as well. So let's break this down. The dog is running. He has a preferred direction to turn in. And if we look even further, look at how they move their legs. So what they're doing is they're stopping quickly. The back legs go to where the front legs are. And then the dog goes to turn. He uses the right leg to turn to the right. And we think over time, this is more of a repetitive strain injury than it is a traumatic injury. Usually by the time you get to the vet for surgery, the ligament has been wearing down and wearing down. Eventually, it just can't take the strain anymore and tears completely or partially. Okay. Now, Frisbee is a little bit the same depending on how you play it. I do play Frisbee with my dogs, not every day, but I try to throw it forward. So if you look at Sam here, I'm throwing it and I'm getting him to get the Frisbee at head height and to keep going straight. I'm not going to lie, it's not easy to do, but the same holds true for a ball. So let's look at how we can do this safely. Now, with a ball, it is a little bit more difficult. Some of the ways that you can play ball safely is doing what I call a dead ball return, because every dog that I've ever met that loves ball, they don't care whether it goes 500 meters or 5 feet. So what you can do is place the ball 20 feet away and have your dog do a sit stay while you go and place it, and then say ready and have your dog run and get it and bring it back. So it's not as explosive. Now, the other thing you can do is throwing it into the bushes. So by throwing it into the bushes, they just can't get the same momentum going, and they're not doing that repetitive turning to one direction. And last, if you have access to water or a beach front or something like that, play along the water edge. The sand is soft, it has a lot of give for your dog's joints, and you can throw it sort of at the water's edge, where it's 2 or 3 inches high. And make sure you go in both directions.